one great pointer is to be thinking about discharge early. There's a lot that goes into the steps of evaluation, treatment strategies, and then reassessment to see if someone is still safe enough to go home. If someone's not safe enough to go home, then as a physical therapist, I'm talking with the discharge planner to have that person set up a safe discharge plan, either at a SNF level or a rehab unit. So it does take time. So the earlier that we can get in and assess and be able to reassess our treatment strategies, the better.
A pointer for new physicians is if you don't know what we do, then just ask. I can give you an example. A resident asked me, quite honestly, well, what exactly do you do? So I gave an explanation of what we do. I also went onto the computer and pulled up some images in Epic about how we do swallowing evaluations and what those swallow evaluations look like. I explained that we also really focus on communication, especially in the ICU. And the physician was extremely impressed and went away and told me that she was going to share that with all her new residents. And that did result in more appropriate referrals for the speech department.
One great tip is that multidisciplinary rounds are very important. It allows team members to know the different scope of practice of the different disciplines involved. Physicians can fully understand maybe why different disciplines are making the recommendations they're making, as well as the progress, for example, a patient might be making with rehab towards a discharge goal. So multidisciplinary rounds help with care coordination in the sense that the whole team is in one spot and can talk in length about a patient and any concerns or barriers that are being had towards discharge, especially in the acute care setting where we're trying to have people meet the goals they need and get to the safest disposition possible. We can work together as a team to figure that out. So frequently, occupational therapy will coordinate with case management, social work, and the team to also identify other resources that might be available that we would not think about if we had not discussed that person as a team. Care coordination can help decrease a patient's anxiety by allowing the patient to feel they're part of the team and allowing them to know the results of the team discussion. Occupational therapy can also help with anxiety management by teaching coping skills as well as goal setting to help everybody feel they're on the same page to decrease the patient's anxiety overall.
Another important point for new physicians is goal-directed care. So, for example, if we're working with a patient that has swallowing issues, it's important that everybody's on the same page regarding what the goals are. Also, if a patient has a poor prognosis or if a patient is towards the end of life, it's also important that we know what those goals are, because if a patient is at end of life, the goals and the treatment plan may be very different from another patient. So, for example, if a patient is at the end of life, we will probably allow them to eat more for comfort and quality of life. Oral care is also really important. Communication at end of life is also very important for families, and we can help to facilitate that.
So one big pointer when you're consulting physical therapy is to be really clear with the order and or the precautions that you want a patient to take. For example, if we had a physical therapy consultation for a patient who just came out of spine surgery, who needs a brace in order to get out of the bed, we want to know that ahead of time. If we don't have clear-cut orders, then what we're having to do is delay our treatment, page the team, and wait for a callback, which can further delay the workflow, which can further delay discharge planning. So definitely be clear in any kind of precautions that you may have, whether it's using a brace when you're getting this patient out of the bed, if they've had surgery on an extremity and they have weight-bearing restrictions for that extremity, that's really important for us to know as well. And any other parameters that would affect us when we're evaluating the patient is really important and needs to be clear when you're consulting physical therapy.